half a pill a day. In some cases, maybe just one pill a day. That might be all it takes to send your testosterone levels skyrocketing to 800, 900, or even 1000 nanograms per deciliter. I have seen this happen countless times. We are going to break down a treatment protocol that is growing rapidly in popularity. It is a method for significantly increasing testosterone, but without the injections. That means doing it without the needles and without many of the heavy side effects involved with traditional testosterone replacement therapy, or TRT. If you stick around until the end, you are going to understand exactly how clomiphene citrate works, what the dosages look like, how you take it, what the side effects are, and exactly what you can expect from this treatment. But first, we have to talk about why you are here. Many men watching this are experiencing the classic symptoms of a crash in hormone levels. You might be feeling chronically tired, fatigued, or noticing that the physical activity you used to do easily now feels like a mountain you can't climb. Maybe recovery time is terrible. You might be feeling a distinct lack of drive in your career, feeling unproductive, struggling with memory, or fighting through brain fog that just won't lift. And, of course, eventually, this hits the sexual side of your life. You might notice a drop in libido. That raw sexual desire just isn't there, and eventually, this can reflect in your erectile function. This is the typical trajectory for a man suffering from falling hormone levels. You become physically debilitated, cognitively impacted, and sexually affected. This starts to mine away at a man's mindset. You start thinking, I'm not the same guy anymore. I can't do what I used to do. I don't care about sex. It makes no difference to me whether I have it or not. But it makes a difference to your partner. Your spouse might start noticing, questioning if you are seeing someone else, or wondering if you aren't attracted to them anymore. These are the heavy questions that come up, and perhaps you are already suffering through them. Now, every patient who feels this, that lack of libido, that lack of energy, deserves a proper hormonal evaluation. However, you have to realize that all the symptoms I just listed are nonspecific. If you are sleeping poorly, for example, you might experience every single one of those things. If you are only getting 4 or 5 hours of sleep a night, you are going to be physically fatigued, your memory will be shot, your concentration will be terrible, and your libido will be non-existent. So, clinically, it is often difficult to define if these problems are coming strictly from testosterone just by talking about symptoms. You have to test. You need a blood panel. And it is critical that you don't just check your total testosterone. You must evaluate the entire hormonal axis. To understand this treatment, you need to understand how this axis works. It's called the hypothalamus-pituitary-gonadal axis. Here is the simple version. Your brain commands your testicles. Specifically, the pituitary gland in your brain produces 2 key hormones, FSH and LH. FSH goes to the testicles and stimulates sperm production. LH, or luteinizing hormone, is the one we care about today. LH travels to the testicles and commands them to produce testosterone. Now, focus on that LH. The system works on a feedback loop. If your testosterone levels in the blood start to rise significantly, your pituitary gland senses that there is plenty of hormone available. It thinks, okay, we have enough, and it reduces the production of LH. Less LH means less stimulation to the testicles, and your testosterone production drops. Conversely, if your testosterone drops too low, your pituitary identifies the deficit. It says, we are running low, and it increases the production of LH to scream at the testicles to work harder. This is how a healthy axis functions. However, certain conditions can disrupt this axis. Sleep deprivation, chronic stress, high anxiety, and a sedentary lifestyle. These are the epidemics of our century, and you probably see yourself in at least one of them. When you are constantly stressed or unhealthy, your axis deregulates. This brings us to a crucial distinction. We often see lab results where a man has low testosterone, but his LH is also low or normal. If testosterone is low, the brain should be screaming. The LH should be high to compensate. But it's not. It's sitting at a 1.0 or 1.5, or maybe even a standard normal number, but it hasn't risen in response to the low testosterone. This is a deregulated axis. Compare that to a man with testicular failure. If a man's testicles are actually broken or failing, his testosterone will be low, but his LH will be massive. The brain is screaming, producing LH levels of 12 or 15, trying to get the factory to work, but the factory is shut down. That man needs testosterone replacement. He needs the injections. But for many men, guys in their 20s, 30s, 40s, and even 50s, they don't have testicular failure. Their factory works fine. The manager in the brain just isn't sending the order. For these men, we can use a strategy involving clomiphene citrate. Clomiphene citrate is technically an off-label use for men. If you read the pamphlet inside the box, it talks about stimulating ovulation in women. But don't let that scare you. It is widely used, safe, discussed in major medical congresses, and established as a valid treatment for male hypogonadism. Here is the protocol. You don't need massive doses. Often, we start with as little as 12.5 milligrams per day. The standard pill is usually 50 milligrams, so that is just a quarter of a pill or half a pill taken every other day. Even 25 milligrams daily works very well for many. So, how does it work? Clomiphene goes to the pituitary gland in your brain and blocks estrogen receptors. It effectively tricks or deceives the pituitary. Even if you have some testosterone, the drug prevents the brain from sensing estrogen, which testosterone converts into. The brain thinks, oh no, we have no hormones, and it responds by massively increasing the production of LH. It cranks up the signal. That LH travels to your testicles, and because your testicles are healthy and functional, they respond. They wake up and start pumping out natural testosterone. The results can be impressive. We see men go from levels of 300 to 1,000. And the best part? It is your own testosterone. Your testicles function well. Unlike injections, which shut down your natural production and shrink your testicles because the brain stops sending the signal, clomiphene keeps the machinery running. Your testicles stay full and active. However, you need to understand the difference between the testosterone your body makes on this medication and the testosterone from a needle. Synthetic testosterone, like cypionate or enanthate, creates a very rapid spike. It hits hard and fast. Clomiphene creates a gradual, slower rise. This means the clinical benefits, the way you actually feel, will also be more gradual. You might see your blood numbers look amazing in 4 weeks, but you might not feel the full energy or libido boost until month 3 or 4. There is a gap between the blood test improvement and the symptom improvement. You have to be patient. Now, we have to talk about the trap or the downside. There are current studies with long-term follow-ups, tracking patients for 3 to 7 years. Laboratory improvement happens in about 95% of men who have functional testicles. The numbers almost always go up. But clinical improvement, actually feeling better, having that libido return, feeling that drive, only happens in about 60% to 70% of men. This implies that around 30% of men will take this medication, see their testosterone hit 800 or 900 on paper, but tell me, I don't feel any different. I still have low libido. I'm still tired. Why does this happen? It is not fully defined yet, but the leading theory has to do with how clomiphene is metabolized. The drug is composed of 2 isomers, zuclomiphene and enclomiphene. Enclomiphene is the good one. It does the heavy lifting of stimulating the brain with fewer side effects. Zuclomiphene, however, stays in the system much longer and can act like estrogen in certain tissues. For some men, this estrogenic activity from the bad isomer might cancel out the benefits of the high testosterone. It can lead to moodiness, emotional instability, or a libido that just doesn't wake up despite the high testosterone numbers. If that possibility worries you, or if you are just tired of waiting months for a solution and want to tackle the physical root cause of ED immediately without prescriptions, you need to hear about a different approach. There is a bizarrely simple, 100% natural purple hardening tonic that men are using to bypass those biological blocks. It takes just 7 seconds to mix at home, and it's designed to target the boner-killing enzyme that pills only temporarily mask. If you want to see exactly how this natural ritual works and read the stories of men who revive their prime performance in days, Grab your phone and scan the QR code on the screen right now to watch a short video about it. I have also pinned the link to that presentation in the top comment below. It is a powerful natural fix worth looking into. This is why there is so much excitement about the future of this class of drugs. In the United States, there are advanced studies right now on pure enclomiphene, often referred to as androxyl, in trials. This would be a drug specifically designed for men, removing the bad isomer, theoretically giving all the benefits of high natural testosterone without the emotional or estrogenic side effects. But for now, regular clomiphene remains a fantastic first-line option to try. If you are a man with working testicles but a sluggish signal from the brain, simply jumping on injections for the rest of your life might be overkill. You might be able to restart your own engine with half a pill a day. Remember, if you fall into that 30% who don't feel the benefits after 6 months, despite the good numbers, then you stop. You realize that perhaps for your specific biology, or perhaps because your symptoms aren't hormonal, this isn't the path. But for the 70% who do respond, it is a life-changing therapy that keeps your fertility intact and avoids the needles. If you are feeling these symptoms, don't guess. Go get your blood work done. Check your LH levels. See if your factory is broken or if the manager is just asleep. It might be the difference between a lifetime of injections or a simple daily pill.